SADC, EU, and Germany, regional response to COVID-19. The coronavirus is spreading across the globe, and Southern Africa has not been spared. Fortunately, SADC, the European Union, and Germany have come together to respond to the negative effects of the epidemic in the SADC region. SADC member states adopted regional guidelines on harmonization and facilitation of movement of essential goods and services that include food, fuel, and medicines across the region during COVID-19 and standard operating procedures for the implementation of these guidelines. The EU has extended additional support of €3.6 million through the Tripartite Transit and Transport Facilitation Programme, coordinated by the SADC Secretariat to facilitate the development of a corridor trip monitoring system. This system will help member states to track and share health information of truck drivers, vehicle loads, assist with contact tracing, and queue management at the border post in order to reduce delays and harmonize procedures and exchange of information along the transport corridors. The Federal Republic of Germany supported SADC with €1.53 million for the development of policy guidelines to harmonize and ease cross-border trade of professional medical services and strengthen the digital infrastructure of the SADC Secretariat and member states. The Federal Republic of Germany also provided a supplementary budget of €1.6 million to support additional measures for transboundary use and protection of natural resources, €500,000, adaptation to climate change in the rural areas, €770,000, and €330,000 for transboundary water management in the SADC region. EU and the Federal Republic of Germany provided support of €3 million through the Support to Industrialization and Productive Sector (SIPS) program, which is aimed at addressing the shortage of personal protective equipment and key medical supplies. The funds are also intended at strengthening the capacity of local manufacturers and developing regional value chains. The EU and SADC provided additional support of $361,000 through the SADC Regional Agriculture Policy Program to support regional and national early warning systems and build capacity to conduct vulnerability assessments of food and nutrition insecurity through virtual data collection and remote analysis processes. The EU and SADC also provided $180,000 through the Global Climate Change Alliance Program, GCCA+. These funds are earmarked for food insecure and vulnerable communities impacted by COVID-19 by improving availability and access to high-value nutritious agriculture produce using climate-smart agriculture (CSA) technologies in Eswatini, Mozambique, Zambia, and Zimbabwe. The EU is also supporting the SADC Secretariat and SADC member states through the Support to Peace and Security (SPSS) program to monitor and address the escalating trends of gender-based violence (GBV) due to movement restrictions imposed on citizens in order to curb the spread of COVID-19. The SPSS program is currently developing awareness tools and information products to sensitize communities, including migrants and refugees, on the issues of GBV. Finally, the EU, in collaboration with 4 United Nations implementing agencies, is providing assistance to migrants, refugees, and support to border posts on infection prevention and control to address emerging needs derived from the COVID-19 crisis. This program is known as the Southern Africa Migration Management (SAM) program. Through these efforts, the EU, SADC member states, and Germany government are demonstrating that together, the effects of COVID-19 can be reduced.